Welcome to the Whole Health Podcast,
where a functional nutritionist and a biological dentist investigate the interconnectedness of your health.
Let's get started.
Welcome back to the Whole Health Podcast. Today we are joined by Dr. Chris Motley. Chris Motley is a globally recognized alternative health practitioner specializing in traditional Chinese medicine, frequency medicine, and kinesiology. His mission is to eliminate fears surrounding health information and empower individuals to take control over their well-being. As the host of the Ancient Health Podcast, Dr. Motley merges ancient Eastern wisdom with cutting-edge Western innovations to offer practical solutions for today's health challenges. With over 120,000 downloads, the podcast has featured leading experts such as Dr. Daniel Amen, Dr. Josh Axe, and Dr. Mindy Pelz. Dr. Motley's unique approach integrates modern technology with time-honored healing practices, recognizing physical, neurological, and emotional health as interconnected aspects of overall well-being. He holds a bachelor's degree in biology from Austin Peay State University, a doctorate of chiropractic, and certifications in acupuncture, kinesiology, and neuro-emotional technique. Through his transformative approach to medicine and passion for holistic health education, Dr. Motley continues to inspire individuals on their journey to optimal wellness. Thank you, Dr. Motley, for joining us.
Wow, thank you very much. I feel very bashful about that. I love the whole explanation, but thank you. It's great. I'm really glad to be here, guys. Thank you so much for allowing me to come to beautiful Portland.
Thank you for making the trip all the way from Nashville.
From Nashville, and I was so grateful that when I first met Dr. Blodgett, like when we had a podcast, I just loved his approach and the way he would focus in on how certain teeth and certain conditions would be associated with certain energy crisis in the body and how it was associated with organ issues, and it really made me dive in even deeper into researching on patients. So when we were talking about coming out here, I was like, definitely. And I got to experience the office and what he does, and I did all the things. And I'm just saying, when he did the PMF with the table, then got to do some of the oral examination, I was on cloud nine. I was zoned. And I mean, last night I got to the hotel and I was like, I think I'm not kind of on a dental high right now. It was really amazing.
A dental high.
It was amazing.
You're coined that phrase.
Totally.
Dental high. It was a dental high. Thank you, guys.
That's awesome. Well, I'd love to start with hearing your story. You started out in chiropractic medicine. What led you to chiropractic medicine in the first place?
I'll make it quick. My dad was a drill sergeant. He was a sergeant in the Army, and they thought he was going to have to have back surgery. And side note too, my brother had dust mite allergies where he's always breathing through his mouth. And so when I was a kid, you always heard your brother breathing through his mouth. You shared the same room. Kind of got annoying, seriously. But one time my dad came into the house and he wasn't wearing his back brace anymore. And I always saw my dad with a back brace, and I was like, Dad, why aren't you wearing your back brace? And he said, I went to this chiropractor, this doctor that did some different things on my back, and I'm not going to have a surgery. And I was like, well, that's pretty interesting, you know. I mean, even at a young age, I was 4 or 5 years old. And my brother, the same doctor said, hey, have your brother come over and get treated. He told my dad, have your son come over. And he started doing upper cervical work. And he said he had some vagal nerve issues. And my brother started breathing through his nose. And you know, when you're younger, you hear that and you're like, that's pretty legit, you know, even at that age. So I kind of had an inkling that I wanted to do something with health. I either wanted to be that or a jet pilot. I seriously did. My dad was in the Air Force. He went from Army to Air Force. I loved getting in the jets. Or a sketch artist. I wanted to be like my brother. My brother's very good at art. I can do things well if I do it repetitively. But we talked about it last night. But one of the things I think I would say is probably in my blood. My mom says that I have some old distant cousins that are in the hills of Korea. My mom's Korean, and they did herbs. And they said my grandfather and great-grandfather used to do Tai Chi up in the mountains of Korea because they came in from China, from Shanghai area. I think what drove me into it, to make this have a meaning to it, is when I got into chiro school, I didn't go necessarily to I do manipulations at times, But my dad, before I went to school, had issues where he would faint and pass out, almost to the point where he called me. This is when early cell phones. And I used to get upset because my dad was a big, strong guy. And he still is. But I used to be a little upset. I'm like, man, why is my dad, almost passing out? He'd go to the ER place and clinics. They give him nitroglycerin. And they would just say, well, your heart's fine, but nothing else is wrong. And my dad had a friend who had a radionics machine. And a radionics machine is a machine that, I don't want to get to the boring aspects of the machine, but it can basically take a hair or a nail sample, it can take a spit sample, and you can take that and you can get the frequency off the material. So he did some things with my dad on this machine, this little machine, and he said, you got parasites in your liver from what I get on the machine. And I was like, okay. And he started working on it through frequency, and my dad started like using the restroom more, could taste metals coming out of his mouth, and he didn't pass out anymore. And when you're, thinking about what I want to do, I said, now that's cool.
Yeah.
And I went, can I keep going? I don't want to take your
Please.
time. I went to another friend of mine who went to my high school, and he was a kinesiology chiropractor. I don't really talk about this too much, but he would treat all the WWF. Back in the day it was WWF. And he said, come and check me out, and I'll work on Jeff Jarrett or something like that. And this guy was a huge guy. He's like, if you do anything, you better get in this kind of work. He goes, because I couldn't lift guys over my head when I did body slams. And I went, okay, that's great. And he said that, you know what? I couldn't work because in kinesiology, your anterior deltoids are associated many times with your gallbladder. So if you have shoulder pain, because your gallbladder meridian runs right here, the gallbladder can get flared and your shoulders get weak. So a lot of people have tears, or have injuries to their shoulders. So he found out that he had an allergy to corn. And he cleared the corn allergy with laser therapy, and he says, I could start body slamming people. And that was just like those little things that get into your brain. And so when I went to school, I went to Cairo, and I thought, well, I don't know exactly what I'm going to do. And when I learned about the frequency medicine kinesiology, there was individuals that had groups and clubs and other classes, and I just dove right into it. And it worked on me. I had a rear end accident. Neck would never stay in place. Went to school, still would get adjusted, didn't hold. Friend of mine, I remember I told you, he said, it's not really your neck, it's your gallbladder. And I was like, what are you talking about? And I wasn't, being sarcastic to the guy. He said, no, your gallbladder channel runs right here. He hit some of these neurolymphatic points, rubbed them out, guys. My body drained. I felt the fluid in the lymph flow. I felt like I was going in rigor mortis for like 3 days. And I slept so much. And I went to the bathroom a whole bunch. And like the third day, I was like, went to class like, wow, that's pretty good, man. And my neck didn't go out again. And it's funny because you look at your history, and my grandfather had his gallbladder taken out. His father they all had gallbladder issues. And then I thought, man, the body tells you a lot of history, So that's, sorry guys, I went through that whole spiel, but that's how I got into it.
I love the story. All these little clues in your history that pointed you down a road in a direction.
Yes.
It's amazing.
Yep.
So when I read of something like frequency medicine, it's a nebulous term.
Yes.
Yeah?
Yes.
Would you mind explaining, because I know I could use some clarity about frequency medicine. What does that mean? How might it be practiced? Where do you see it applicable?
It is a nebulous term because I know there's a lot of practitioners out there that say they do frequency medicine. And at the time, I would say, yeah, I practice some forms of frequency medicine. And what that would basically mean in my world is if you can have a device, whether it be a mechanical device, an electrical device, or even have like a person who has enough intuitive nature to actually feel energy that runs through the body, if the body is emitting enough waves through light or through sound, and that all depends on how fast your energy is running through your skin. So you have energy, chi, running up these meridians, and the speed or the efficiency of that current running through your skin, if everybody can imagine, or if you're listening, that will give off little sound waves. It'll give off little waves of energy off your body. And they say that those waves literally will emit, and it can create membranes around your body. And so they call it a biofield. So frequency medicine would say, are there devices or ways to measure the frequencies, the waves coming off your body, and being able to digitize or measure those waves and give it a reference, saying this wave or this digitized number means bacteria. And so when you have that kind of information come off the body, are there ways where you can invert the wave, turn it over, cancel the wave, or are there ways you can use laser light to actually mend or treat the biofield? And those are ways you can use frequencies coming off the body and other devices to actually mend it. And so some people say, well, I use frequency medicine. There's many ways. It's a nebulous term. In Chinese medicine, what I like to do is, I'm very basic and archaic. I will find if a person has an area on the body or the shoulders where there is a blockage in chi or electricity, you can find it, and it'll actually change the distance of the field around that area. You can have a very large field or very short, and if you can move and maneuver that energy through that shoulder, it'll restore the field around the area. So there's many ways you can assess that. I hope that was a decent explanation. But all day we're doing it. You know, when you're around somebody, and the people guys here, like if you around somebody say that person gave me a bad vibe, that guy, I don't feel right around that guy. And it's essentially what's happening is your body becomes a grounding rod, and so you become an antenna. And so what you do is your sensors in your body pick up on the waveform from somebody else, and you innately take that information in, and your brain will literally make chemical changes and electrical changes, and you get an idea about that person. And that's frequency medicine in itself. And I know it's a big catchphrase. I'm very, very cautious because you know, I use a lot of manual maneuvers and needles and stuff like that to change the frequencies. But now they've got such great stuff. I use a lot of laser therapy to change the field. I hope that was a good explanation, but that's where it's at, yeah.
Thank you for that explanation. And I think it gets to a core principle that most of us don't. We probably go through our day, most days, not being conscious of the fact that we are living embodiments of energy.
Yes.
Without it, you would be, you know, a blob on the ground, you know, you'd not be a living entity. So sometimes that can be hard to visualize.
Totally.
I think we were talking yesterday about EAV, electroacupuncture according to Vol, and the fact that we can actually measure energy flow in a human being, I think is fascinating, and kind of reiterates that, yes, there is energy flowing, you know, and you can't have energetic flow without creating a magnetic field.
Yes.
You know, and so that's kind of in my mind how I envision this energetic form. But I like the way you were describing that, particularly like the field around us and the layers. And
I love it that when we look at all the great people on Instagram and they talk about fascial work, and in Chinese medicine they would say that the fascia is the master system, and all that chi and all that electricity is maneuvering its way through this fascia. And you're right, that current is just like if you had wires in the wall and that electron's going from the switch to the light, the speed of that electron emits the electromagnetic field around the wire. And so that's happening in our skin all day. So we are literally emitting that, yeah.
Okay, because that answered a question in the list of millions of questions that have been in my brain in that explanation.
You just totally screwed things up.
Questions. No, I love that. So I was wondering when you were initially talking about this, if the lymph acts as the conductor, but you're saying the fascia is kind of the conductor of the electricity.
They can all, yes. Fascia normally does. Yes.
And you know, I use acupuncture all the time, and I guess I'm not asking enough questions, because when you're needling, then are you actually, is that what you're affecting? I know we talk meridians all the time, but is it directly affecting the fascia?
It totally is. They do a lot of microscopic images of when the needle actually gets into the fascia, and they say that when the needle head goes in and it hits the fascia is running current through it because it's made of all the proteins and water, so a little bit of sugars and such. And when you twist the needle, the bending of the fascia, the twisting of the fascia when you put the needle in, is actually what creates the charge, like bending of crystals. So if you guys, like your bones, your piezoelectric crystals can, you know, they compose your bones, a lot of your fascia, a lot of your DNA. When you twist a needle, you're actually deforming the crystals, and that's what creates a spark. It's just the same type of technology. Like when you go to, remember the old gas grills where you hit the button and it would charge, pow, 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 and it would start the fire, because they're just taking a quartz crystal and they're bending it and it creates a charge. It's the same thing that's happening in your skin.
Is it at the point at which the electricity stops flowing that you're trying to hit with that needle, where you're like, okay, we're going to
Normally.
recharge? Okay.
That's where I try to find the area. I'm sorry if it's getting too technical. I know,
No,
but it's like,
sorry, I'm going to go technical because that's how my brain works. So in case anybody's listening that actually is technical, we're going to go there in just a second.
yeah, like the twisting, like the fascia gets bound up. And that's where when the blockage occurs, you want to put the needle there, or you can use pressure. And some people say what's good, like laser, needle, pressure,
Okay.
which is best.
Okay.
I think they all work really well. It just depends on the practitioner. Yeah.
Okay. So can we go back to parasites for a second, or just infections?
Let's do it.
Okay.
Yes.
All right.
Yes.
So I had this visual when you were talking about this, that there's this energy field around the body, and the current changes if there's an infection. As a reflection of the environment that is hosting that bug, like as in when you said you can shift the current, in shifting the current, does it change the environment and therefore now the bug cannot thrive there?
That's one great way to put it, yes. Because you always want to make the environment inhospitable
Yes.
to the critter. There's different ways you could do it. So if you had a frequency of a parasite giving off a certain wavelength, like sometimes they exist in like the 700 microhertz level, if you can invert the wave, you could actually tear the parasite apart. You know, when you look at microscopic views of microcurrent, just look it up, Google microscopic or microcurrent treatment of parasites, and you can actually, it'll put the resonant frequency into the parasite and it'll pop it open. Or you can use the frequency to encourage the strength of the area where the parasite is.
Okay.
You can do it that way as well.
So you're building up the host's immune defenses?
Yes.
Is that what you're saying? So therefore it can kill the parasite
Yes.
with its own immune system?
Because you want it, after a while, you can always kill an infection and kill it off. But if the memory of the tissue is adapted and comfortable to the infection, you are more prone to keep returning or having that return to the tissue. So I find that, do you guys find that like if you do a homeopathy treatment, it's more important for me to put a homeopathy treatment to encourage like the strength of the spleen and get your brain to be in such good connection with your spleen and say, okay, you're healthy now, that bacteria is not necessary for you anymore. And I think that one of the best ways is to encourage the strength of the organ to help push that stuff out. Yes.
Well, I think
I love this so much. I do, because we're forced to try to address these infections in so many ways. Some we can test for, some we can't test for, with, the tools that I have. And then it's like, okay, well, we're going to kill this with herbs. Yeah. Oh, it didn't work on you. Yeah. Like it worked on you, it didn't work on you. Oh, there's something we don't know yet. Or there's variables we don't understand. And the concept that energy has the ability, you can measure the energy to identify the imbalance is so fascinating.
It is true. I mean, I think that if you found an area, like an organ that kept having a bacterial or viral infection, if you kept cleaning it out, which we all have done, and you think, oh heavens, you guys have done this. Like you get rid of something, and 6 months later you come back and go, strep came back. How did that come back? And as a practitioner, you get upset. But then you realize that the organ was always in a connection with their mentality, with their brain, and their brain was communicating with that organ a certain message, a certain program, and you go, oh, that organ was tired. The spleen's tired from the way that person's thinking. So that person could be always worried or over-concerned, and you think, that's the other, like you have to dig in, and you find out. Then I give them the homeopathic to get them a better communication with their spleen, and then they start to listen to it, and then they go, oh, yeah, I do worry too much. And then the parasite or whatever it is goes, oh, I don't want to be in that area anymore.
It's no longer
all
comfortable
recognition.
for me to be here. Oh,
which even your thoughts are energy.
Yeah, that's right.
Energy.
Totally.
Yeah. I know it's kind of mind-boggling, isn't it?
I don't want to get too wordy. I think that when we talk about like emotions or organ systems, I think one of the things that's really interesting, and chime in, guys. I mean, do you guys think it's really, really interesting when you look at the action of an organ? And let's say, like my gallbladder, like my grandfather had his gallbladder out. My dad had really bad gallbladder problems, and they would always have stones or sludge in them. And, when you talk about dentistry, when you talk about the gallbladder teeth can get irritated or inflamed, and you think, well, the gallbladder's not flushing well. And then I've done a lot of gallbladder work on myself and on patients. And I found out, like, people say, well, the gallbladder, if you guys don't know much about the emotions, organ work, it means like a lot of frustration and resentments built up in the body. But I think it's really, really interesting that you always have to look at the action of the actual organ, and the body would say the gallbladder is there to help you create energy. It creates bile. It helps you digest your fats, helps you digest your foods, and it's picked up the pace when you are in stress, saying, "I've got to create energy." And what does your brain do? It tells your gallbladder, like, "You need to help me create energy." But I always say, but the reason you're creating energy is because you are trying to meet somebody else's demand. And you're frustrated because you have to meet somebody else's demand. And I say, look at your life. And they're like, are you frustrated at somebody because you have to keep doing what they tell you to do? Yes. Do you feel like they took your identity away? You became what they wanted you to be? Yes. Gallbladder 101. That is gallbladder 101.
Obviously.
And it's like this, like whenever you hear somebody say something, like when they come in and I'm like, what's your gallbladder like? And they never get it checked. And so the beauty of it is, get them on a couple herbs, but then I always go into the gallbladder homeopathics and a few energetic, like unblocking, and you'll start to see them start to recognize when they feel like their identity is being taken away by this person. And that's the goal for me, is like, you have to realize when you're in your program, like when you're in that repetitive program. And I don't want to sound like cliche, but I think that's where is that where healing begins? Is like when you recognize what programs are just repeating patterns in your life. So anyway, don't want to keep the conversation.
I did not think we were going to go there, but
I'm so sorry.
I'm so glad that we did. I'm so glad that we did, because I think when you're in practice, and if you have the luxury of interviewing people to understand their whole history and their trauma and their experiences of their current family and their family of origin and their job and all of those things, you start to see these patterns that do show up in what we would call a symptom or a disease.
Yes.
Where the suffering is patterned between certain things. And I am not going to say these patterns, because some of them I think make people feel badly about themselves. But I see certain disease presentations and I think, man, that person is holding something brutal.
Yes.
Right? Whether it's a secret that they're holding or a shame that they're holding. And it does seem to show up energetically in patterned ways. And I think we miss that.
I definitely do. I agree. I think that when we see patterns, like when you guys are in practice, you'll start to see like a repetitive pattern. Sometimes I would question myself saying,
yes.
Is it me?
It's my inherent bias. Yeah.
But I know we always have really great stories and explanations, but when you see patterns develop on individuals, where you can look at somebody's, let's say, facial mapping, and patients would come in and they would say something to the extent, like they'll give you a little brief background, but you look at their face and the energetic pattern is they'll have like dark circles underneath their eyes. They always have low back pain. Their hips are always stiff. And then when you look at that, the first thing I would say is like, do your knees hurt? And they're like, yeah. Do your calves get tight? I'm like, well, it's probably kidney. But the goal is, I try to look in their history and say, well, what did your mom experience when you were in the womb?
Yeah.
And when you look at the eye, like right side, usually like a lot of female DNA, left side's a lot of male. And then you look at and see which side has the darker circle underneath the eye. And you're going to be like, your mom was completely afraid, right? And they're like, how did you know? Did somebody give you an explanation? I was like, no, it's just patterns on your face.
Instagram.
Yeah, and it's just like you measure patterns, And I think that's the beauty of it. Like your body, like the body keeps a score.
Yeah.
Like the body does tell a lot of stories, And I think we all inherently see in people's faces in life, don't we? Like when you encounter somebody, you're like, you're not having a good day, right? And they're like, how'd you know? Yeah.
I'd love for you to dive a little more deeply into homeopathy, because it's something that we, offer our patients, particularly like in preparation for and post surgery. But I think for a lot of people, like homeopathy is this thing like, what is that?
Yeah.
Could you explain what it is and how that becomes a instrument in your bag of tricks?
Oh, totally. So if you're listening or watching, I don't want to butcher this, but I probably will. But when you talk about homeopathy, they say like treats like. So they'll take, like, let's say the component or the energetic essence of a flower that has a certain type of frequency emitted from a flower. So follow me, guys, like a petal. Yep. And they put it into a fluid. And what they do is they keep diluting the fluid They dilute it. They'll take one drop of this whole vat of water that has the energy of the flower petal, and they'll put it to another vat of water. And then they keep diluting it drop by drop. And the more you dilute, this more concentrated energy of the original flower petal. That's what they'll do with the homeopathy, right? Now, some people say, well, how would that help? What are you talking about? And I'm like, I get it. But I always think, remember, guys, it's like music. I love this studio. Oh, my God, it's like the best. You guys have the best setup. But it's like tuning forks. Mm-hmm. So if you guys can think that if you had a homeopathy remedy that was for, let's say, a bacteria like strep, if the strep is dormant in your body, it's lying low, and it's been draining you of energy, being in your cells, being in your tonsils, being in your throat, being in your lymph system, if you took a vibrant homeopathic, which had the frequency and energy of strep in the actual liquid, and I dropped it in my mouth, it's going to send an energetic wave to that dormant strep and wake it up. Because it has the exact frequency of what you just took. That strep, it's a tuning fork. You had a really vibrant tuning fork here. It sends the energy to that dormant strep. It wakes it up, and the strep wakes up and goes, what is going on? It absorbs all the energy of that homeopathy, and it's vibrant. And then when it gets filled up with that energy, it sends it right back to the homeopathy. So you have this little game going on when you're in, and it's like you swallowed a tuning fork or took a tuning fork, and it woke up all the strep, and they're exchanging energy back and forth because they're two tuning forks of the same note. And so they're just exchanging. And what you're trying to do is you're trying to drain the energy of the strep in the body so that it has no more energy to be vibrant. And so at the same time, the brilliance of the people who do this homeopathy are finding homeopathy that would strengthen the tissue as well. So when you're taking like a combination homeopathy, I tell people, I know it seems very like ineffective. You're taking these drops, letting it sit underneath your tongue. You're just like, it doesn't work. I'm telling you, you're waking up old, dormant stuff, and you're sending all the energy back into it. And I said, you watch. That strep will start to flush, and you'll start getting these little symptoms, and you think, could it be that? So it's a game of cat and mouse with homeopathy. And all it's doing is reminding your body of what you forgot. I always think that, if there was something that you thought was hiding in your house or something that was, termites, if you got used to termites because you never saw it, the only thing you would notice is that maybe the wood was a little chipping off a little bit or something of that sort. But the body forgets. It gets adapted to the problem, and it's almost like, oh, that strep's been there for a while. I'll just keep adapting. And then they give you a blood test back and says, oh, you're a strep carrier. But don't worry about it. You're fine. And you're like, no, it's in my cells. And they think it's okay for it to stick around, and that's why people get chronically sick, and they get rheumatoid arthritis, and they start getting all these things. And so when you start to use homeopathy, I on my own, I say it's one of the most potent types of remedies you can use. Then I use herbs to go in there and clean up when it pulls it out. So I always try to bait it. I'm like, okay, all right, take this. And then you start to test. I'm like, it's coming out. And then take the herbs and concentrate the herbs and start flushing it. That's how I do it. Yeah. And she's like, Meg's like, you're crazy.
No, I'm like, this is an amazing tool and process for things that we cannot actually address. The combination of everything you do. Mm-hmm. It's not one thing is the catch-all for every treatment for every person, right?
No.
It's like there's energy fields, there's bugs that disrupt our energy fields, there's humans that disrupt our energy fields, there's environments that disrupt. But I was even thinking, it's like Stranger Things stuff here, but I'm thinking like we do adapt to the pressures of our environment and forget that they're there and downregulate our energy to match.
Totally.
Right?
Yes.
Like I am a very clean person. My house is pretty much always put together.
Yeah.
I got bookends of the day for that. But my pantry is a hot freaking mess. And I look at it every day and I'm like, it's fine, right? Like I've adapted to that disaster and everything around it has to be controlled. And I do think about all those childhood infections we get, the streps, the Epstein-Barrs, Lyme is, one that is constantly evading us. But our body makes this little adjustment and then we just never feel awesome again.
Yeah. No, I'm with you guys 100%. I think that, with Lyme or parasites, and you made a really great point. I mean, there's people in our lives that are homeopathy remedies that are not great for us. I mean, you get around those individuals and they have a frequency and it wakes part of you up that it's like, oh, this person's angry, and I have dormant anger, and it wakes it up. And so you're right. You could be tuning forks with other people, and that's why it's always be careful of the people around you. And I think it's also cool that when you say like your pantry is like, like it's a hot freaking mess. I always say that like if everything else is really really clean, they would say that you always look back at the person's initial when they're young, or look at and say, well, why would your pantry or where your food's at be a mess? Because when you're younger, it could be that your digestive system is messy internally, and in your programming, you've adapted to it. And that's the first thing I would check with you. Like if you told me something like that. I'm not saying it's the case.
But it is the case, and we're going to talk after the show, because now I'm going to have to fly to Nashville, obviously.
When are we taking that trip?
Obviously. Wow. Yeah, so complex,
I hope I'm
and
not
yet
boring you guys to death. Seriously, guys.
do we sound bored?
No,
I'm about
seriously,
to jump out of the chair right now. I'm so excited about this.
No, it's just this is so fun. It's so easy too. Like when we're talking about like healing, because I don't want to take the conversation over, but when you look into frequencies or energetic medicine, and a lot of people use energy medicine in like a very broad term, but I do think that when you can realize that there's patterns like in acupuncture or in Ayurvedic, or there's different types of discipline. But if you are a person of patterns and you try to take that energetic quality of a person and put it into a pattern, you can do a lot of good for people. And I love it because if you came into the office, I always look at symptoms, and I will always find the placement of the symptom. And a person will tell you which meridian is totally off if you go through all their symptomatology, like where their body hurts. Okay, so you guys, everybody out there listening, write down muscle aches and pains, joint pain, joint swelling, any inflammation, acne, any type of markings that you may have. If you look at even where your hair is coming out of your head, if you look at these little patterns, they will always be coinciding with a particular meridian on your body. It'll follow a pattern, like a little highway. And if you follow it, you will find the original organ and all the related organs. And so when you find all the related organs, you will go down a rabbit trail. It is a rabbit trail, and it can be tough. I've had patients, I know you've had them too, I have like beat myself over the head. I got this. I know what it is. And I think this person's done well. And then after like 4 months, they start to feel sick again. But I would follow a pattern, but I wouldn't look at all the related patterns, like which organ led to this organ. I always like focused on one organ. I go, oh my word, they just got a test and they had E. coli. And that what irritates me. I get so mad when I'm off like that. But I love those kind of stories for myself. But I've literally had individuals where clear everything up. It was like 3 weeks ago, and I was like, you know what? Something's up with this lady. She said I had all these surgeries, had all these root canals. And we had our membership talk, and I told her 6 weeks ago, I said, from my scans of you, you got tons of C. diff. Okay, so she's like, really? I said, I would ask your primary care doctor. And she started going, I was working with her. She would kind of feel good. She started feeling really good. It's like, oh man, she goes, well, I'm on this other regimen. I'll take some of the stuff to help overall. I'm like, good. And all of a sudden she calls me and she joins the membership meeting, and we're on a Zoom, and she's in a hospital bed. And I'm like, well, that's just great. Like, that goes my rep. Like, and nobody's going to listen to me now. I was like, what is going on? Like, are you okay? And she goes, yeah. She says, I got super sick. So that's what I'm saying. I got frustrated. I'm like, you were good for 3 to 4 weeks, and now you're not doing well. And then she said, hey, she goes, I don't know, it was God or somebody told me, but she says, remember you told me I had C. diff all over me? And I was like, yeah, I did. I found it like high percentage from my scan. I was like, well, what happened? She goes, the doctors and the nurses thought I was crazy. And they're like, you don't have it. And she goes, please. And so they did it. And she said, it was so high. She gave me the report that it was off the charts. And they gave her some antibiotics. And like most of all her abdominal pain she's had for like 6 years has gone away.
Wow.
But it took my mistake. I found it, but I was like, I didn't aggressively. And I was like, where was it at? And she goes, it was in my appendix area.
Oh, wow.
See? And in Chinese medicine, if you guys don't know, the appendix is like, it's around the small intestine and large intestine. And all I did was concentrate on the large intestine. when I should have gone to the small intestine. I didn't follow a pattern. And so that's why I'm frustrated with myself.
How dare you?
I divert to like always trying to make sure that everybody, when you study Chinese medicine, guys, remember it's like the 5 elements. Like follow the 5 elements. You burn the wood, you take the wood, you burn it, it becomes earth. Earth starts to mineralize, becomes the metal. Metal feeds the water, and the water feeds the trees. It's like that with organs. I promise you, it is. It seems it's like it's complicated, but it's not. If you just study it, yeah.
I almost feel like he says everything's connected.
Weird.
Wait, what?
What are you talking about?
That's awesome.
Guys, this was the lowest ranking podcast. I don't think the guys in the cameras are like, dude, I don't know what is going on with this guy.
I think it's really exciting. I mean, everything you're saying, I was pondering this patient that has been really sick, and he's lost, I would say, his life force. Like he has 3 children, he's married, he gets up every day, he goes to work, he never feels good. And he used to be a surfer, and he was just filled with life force. He was one of those people that was really on that end of extreme. And we have been going rounds trying to figure out what's going on. He's convinced he has Epstein-Barr reactivation. None of the things that would normally apply are working. And he said something to me that I a little bit dismissed because it was joking. I said, is there anything else, anything, think back to the period of time that you started feeling these symptoms. Is there anything else you can think of that shifted? And he said, the only thing I can think of is, and I've wondered about it, that I might be allergic to my wife. Well, I kind of internally laughed, right? Because I was like, well, those of us that are married know that there are, you're like, you're really ruining my energy field right now. But he's like, I started feeling really bad around that time that we moved in together. And the more I'm listening to you, the more I'm thinking, that's not necessarily something to dismiss, because sometimes we do have relationships, even with people we really love, that shift our energy, downshift our energy.
Yes,
they
and definitely do.
And it removes our strength to fight these little bugs or to keep these bugs, in check, because we're being deflated almost by those interactions.
I think it's very valid to say, like, let's say if you were married or you had a partner that had bad kidney issues, if you sleep beside them, you remember, like, 2 wires that are running current beside each other will actually exchange electromagnetic field, and they'll change the actual speed of the electrons in each wire. That's why in the wires in the wall. So if you're sitting beside somebody, your kidneys are basically going to pick up on the frequency given off by their kidney, and they'll try to actuate with you. You'll try to match the frequency or energy of their kidneys. So you ever have people that talk to you and they're like, hey, and they're real loud, and you're like, dude, bring it down. Like, and you'll be like this, and you like start talking the same.
Yes.
Your body does the same thing. It's just literally trying to match tone.
So fascinating.
Right? It's like you naturally do it. And so the kidneys start having, this is what's funny. It's like, I've had patients, like, not saying man or woman, but a guy came in, he was like, man, he goes, doc, my back is killing me after he met his woman and, they got married and everything. And when I checked her, she had really bad kidney issues. And she had all the signs and symptoms of bad kidney. Kidneys are about mineralization. She used to get like cavities. She would have bags underneath her eyes. She'd always be fearful. Kidneys are all about adrenal and fearfulness. Like, I'm always afraid. And so he would have that. And so then, let's say she had strep or Epstein-Barr. She gave it to him, of course, whatever. But the kidneys got so weak, he started to match her vibe. And so people say, can they make me sick? I'm like, well, you both got to start cleaning it out now. So if a patient comes in with their whole family and one's like, well, he's got Epstein-Barr, like, no, you all got Epstein-Barr.
Yeah.
You're in the same house, that same energetic frequency, that house needs to be cleansed, like they say. Like, remember that movie? But truly, that was a horrible, but I know we have a lot of stories, and I don't want to bore everybody listening, but I would say, like, for instance, I had a little guy, he was 4 when he came in, 5, and his mom brought him in, and he had so much eczema on his body that he wore mittens since he was born. And you guys seen that. And so he was like, he had it all over. I mean, like, when they brought him in, I was like, poor guy. Well, the doctor said, hey, you're going to have to just use anti-itch cream and cortisone cream for the rest of your life. Just keep it in there, right? Wow. So now this is fast forward, we got him out of it. We found a ton of strep in him. But she had it, and when you checked it, it was all of her meridians around her lung meridian and spleen meridian over her chest, and she had strep all in her. But it was in her breast milk. Right. So then you can't tell a mother that. She's going to feel bad about it. Yes. Like, no, don't say anything about it. But when I started cleaning him out, the brother started to emit stuff. They started to emit impetigo. Stuff started coming to the surface after I started working homeopathy with the little guy. And so they start to clean out. The little brother starts to get all this stuff start to flush out. And so they just had a newborn, like she's like a few weeks old. And I said, well, the whole family needs to be treated. Granted, the little newborn has they probably had some, like breast milk from the mother because the mother didn't really treat that much for strep. So we started using a little homeopathy. And when you know it, the little girl, the little baby, started getting rashes of eczema all through her cheeks because of her breastfeeding. It was all in her salivary glands because we were clearing the kids out, the boy and the brothers. And the mother was picking up on the frequency, and she started to emit it. It was coming out of her. Isn't that crazy how much energy travels in the house? I'm like, and this is not just random, guys. I see this a lot.
Yeah.
And
of course, how can it not be?
Yeah.
I mean, it's shared.
It's shared.
All of it, all the energy.
Truly. So if you're in a house that people have sadness, that's no joke. Like if you have a person that's chronically sad or chronically angry, you're going to get it. I hate to be like not negative, but you better watch out, Yeah. And I always say that when people say protect yourself, like they'll say I wear a crystal or I use essential oils. I've had time when people would come in, I'm like, you need to lather that oil on. You better put a lot of it on and bathe in it. And I was like, when your mates sleep, just pour it all over them. And like, you know what I mean? When people put like potatoes in people's socks, or like put like something in their socks or something.
It's your energy shield of essential oils.
Yeah, you smell like sage.
Yeah,
yeah, you do.
Oh my gosh, that's great.
Good visuals.
Yeah.
Oh my gosh, we could keep going forever.
But forever. No, I love it. I love it so much.
We love to end, Chris, by asking, what does whole health mean to you?
Whole health is, when we say holistic health, like in the whole body. So people, I always think that, yes, it's mind, body, spirit. But I always say when you can recognize your emotional patterns and really understand how you feel about something is like the first step to understanding whole health. Like, because this is how much of a receptors we are. We're so good at feeling how other people feel because when you're in the womb, in your mom's belly, you picked up on how she felt and you absorbed a ton of it. And what we do is we spend the rest of our lives ignoring how our parents felt, and we do not understand that those feelings that they had, we try to cope with, and that can create a lot of our problems. And whole health is understanding that I understand what my mom or my dad was going through. You could blame if you want. It's up to you. But understanding that the effect it has on your cells and going, you know what, I have to recognize that and understand what they're going through for me to understand myself. So that is whole health to me. So,
wow.
That's awesome.
I love that. Thank you so much for being here with us. Thank you for flying in to be with us.
Yeah, thank you so much. And this was so fun.
Appreciate it. Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time.